We're here at the Sullivan County Regional Health Department where beginning today, Monday, April 20th, testing for COVID-19 will be available to any Sullivan County resident at a drive-through testing site, regardless of whether they're exhibiting symptoms. We spoke with Health Department Director Gary Mays, who shared with us how this public testing was made possible. So when the COVID-19 pandemic first reached our region, testing was generally somewhat limited to those who were maybe exhibiting symptoms or those who had a higher likelihood of exposure to the virus. What led to the decision to open testing more broadly, kind of to the general public, even those who may be asymptomatic?
Originally, when testing wasn't available, it was mostly due to the fact that this was a novel virus. In other words, it's brand new. No labs had capability for testing for such a new virus. And so it took time for reference labs or state labs to gather the appropriate test to make sure it is an accurate test. The worst thing that could happen is to rush into something and have lab records not be reliable. And so testing had to be developed, supplies had to be developed at a huge scale. And so the reason that we are testing openly now is because we do have that lab capacity, we do have the materials and the supplies we need to do the testing appropriately, and that just happened literally last week. And so we've opened it up for the citizens of Sullivan County, Kingsport and Bristol to come and participate in testing.
What resources, whether local, state, federal, I know we've seen announcements of these drive-through testing sites that have opened all over the state, really, just this past week. What kind of resources made that level of testing possible?
Well, what really made the level of testing possible is cooperation of our local, state, and federal government. I can tell you that at the local level, the mayors of Kingsport, Bristol, and Sullivan County and Bluff City have been working together frequently and often, and have been extremely cooperative with the public health and the state and federal guidelines. It's really been a total team effort, even at the governor's level and the federal level. The allocation of assets and resources and personnel resources, the way that we share knowledge and information has been extremely valuable in the way that we serve the public. And so all of that working together, and not to mention the public, our citizens of Sullivan County have been extremely cooperative and have done the right thing to minimize the spread of COVID in our county, in our cities. And I think it's been a total team effort. And I think, at least at this point, it is a time that we can look back and be proud of what our citizens have done and what our local government has done and state government. And so all of these assets and resources are converging to working together for testing. Let's understand where the disease is, who is symptomatic, who do we need to do isolation and contact tracing on. And then eventually, in a few weeks, we are very hopeful that we'll be able to do the antibody test, and that will allow us to understand better the population in terms of immunity and who has been sick. All of these things happening over the next few weeks will move us to a closer end to this disease, and we hope that'll be very soon, and not for a period of years, but for a period of months. And not to mention that we don't know what the disease will do in the summer months, and we certainly don't know what the disease will do in the winter months, but we will be better prepared than we were in January, without question.
What's the department's capacity for testing in terms of the number of tests available, at least initially?
Well, initially we're meeting that need. The demand for appointments and folks wanting to be tested has been adequate with our capacity for now. We realize that surge could happen, and we're prepared for that, and so we can scale up as much as necessary, at least that we see based on demand. And so right now we feel very good about the public's response and the desire to be tested and our capability internally with our own staff at Sullivan County Regional Health Department, which is doing an amazing good job. They're an amazing team. And I could not be more proud, and the citizens of Sullivan County, I believe, could not be more proud of our health department. But also we have a cadre of volunteers that are volunteering their time, RNs and doctors. Very thankful for that. And of course the leadership that we have in our city and our county government. It's all coming together very nicely, and couldn't be more satisfied as someone in my position and fortunate enough to be in my position during this time to see a total team effort unlike I've ever seen before in public health or anything that I've ever been involved before.
How quickly will test results come back, and how will individuals be notified of the outcome of their test?
It's a good question, because the backside of work involved in this needs to be carefully done. And so we are hopeful that we can get test results back less than 5 to 7 days. And those positives will receive notification from us, a phone call from us, because we obtained their phone number. And we'll reach out to each resident and follow up with them on the information, which is vitally important.
Do you anticipate testing extending beyond the current projected end date of May 1st?
I do. I think we will be testing for several weeks until we have met the public's need and expectation. I think we'll be continuously testing, looking for the disease, trying to detect those that are sick. And as I mentioned earlier, hopefully in a few weeks we'll be doing the antibody testing, which is different than what we're doing today. And so hopefully we'll have the whole mosaic of testing together for Sullivan County in a few weeks.
We also spoke with Dr. Stephen May, Medical Director of the Sullivan County Regional Health Department, to learn more about the process and what the benefits are of being tested. So, Dr. May, who should consider going through this testing?
Right now, we want to test anyone who has any type of respiratory symptoms to see if they're a potential case. And right now, we'll also be testing those who just wish to be tested.
So we've heard about a number of different types of tests, whether it be blood tests, swabs, different tests that look for antibodies, etc. We've heard about all these in the news. How does this particular test that you all are doing work, and how accurate do the results generally tend to be?
Okay, the current test we'll be doing is the PCR virus detection test. That's completely different than the blood test or the antibody test, which we don't have widely available in this area yet. But we'll be doing the virus detection test. The sensitivity on that from current studies appears to be about 70%. But the problem is it's got to do a lot with how the specimen is collected, how it is transported, of course, then sensitivity actually in the laboratory.
What can individuals being tested expect to experience during the process?
Okay, this is different from your regular standard throat culture test. This is called a nasopharyngeal swab, and what we do is we take a very thin, narrow swab. We will come and approach it straight through the bottom of the nose, going over the top of the roof of the mouth, straight back, and the posterior pharynx is right in front of the ear. So we go straight back with the swab, rotate it a couple of times, then pull it out. So it's not your standard tickle your tonsils test.
So possibly not the most pleasant thing that someone will experience all day today.
It's uncomfortable, but it is the most accurate way to get reliable results.
What should folks who receive the test do between being tested and the time that they receive their results?
Well, if they're completely asymptomatic and we're just doing routine blind testing, they can go about their normal activities, maintaining regular social distancing that we should be doing all the time. If, however, they have any symptoms at all, they need to be isolating themselves until we obtain the results of that test.
From a public health perspective, what benefit does this type of larger scale testing provide, even when many of the individuals being tested are asymptomatic?
Well, this gives us a better idea of penetrance into the population, and also looking for those people who may be asymptomatic and yet have a positive test. And it gives us a better understanding of the population dynamics that this virus may be exhibiting.
What happens if an individual's result ends up coming back positive?
Okay, if it comes back positive, you're going to be receiving a call from the health department. We do a detailed case interview. We will place them into isolation for 7 days at a minimum, and we want the last 3 days to be asymptomatic. The second piece to that is, of course, contact investigation or contact tracing. With the contact tracing, we want to find everyone this person has been close to 6 feet for greater than 10 minutes. We want to place them in quarantine, which means we want them isolated from other people should they become sick. And if they develop, the contacts develop symptoms, then we want to be sure and test them to see if they're positive.
For individuals whose results do come back as negative, does that mean they're free to just resume normal behaviors? They're free and clear, they're good to go?
Well, they still have to maintain the social distancing parameters because this does not tell you whether you're immune or not. It tells you whether you have the virus and are excreting the virus or not. So those are two very important differences that you need to understand. Now, if they're symptomatic with any type of respiratory disease, positive or negative, we are still recommending the 7 days minimum rule to isolate yourself with any respiratory illness with the last 3 days of feeling well.
Like all employees of the city of Bristol, Tennessee, I've been screened for symptoms, including a temperature check at the beginning of every shift for the past several weeks. Now, thus far, I've fortunately not shown any of the symptoms commonly associated with COVID-19. Nevertheless, I'm going to be tested today myself in order to provide a first-hand account of what the testing experience is like. Individuals being tested should enter the health department driveway from the rear entrance off of Massengill Road at your scheduled appointment time. You will then be directed to the testing lane assigned to you. When you have reached the testing point, health department personnel will describe the testing procedure to you and ask that you lean your head back against your seat's headrest. They will then insert the swab into both sides of the nose for several seconds. The sensation is a bit uncomfortable, but not necessarily painful. Based on my own experience, I would recommend concentrating on breathing through the mouth and keeping your jaw relaxed. You will then be provided with some additional information from the Tennessee Department of Health regarding appropriate precautions to take while awaiting your test results. As Dr. May noted, the test itself is certainly not a pleasant experience, but a few moments of discomfort today are well worth the benefit that this information provides our public health officials as they try to understand how this virus moves through our communities. It may also provide much needed peace of mind, particularly for those caring for loved ones who are at higher risk for complications from this disease. Testing is currently scheduled to be available for Sullivan County residents through Friday, May 1st. Tests are administered at the Sullivan County Health Department here in Blountville, Monday through Friday from 1 p.m. until 4 p.m. Now, they do ask that you make an appointment by calling the health department at 423-279-2777 during regular business hours. For more information, please visit the health department's website at sullivanhealth.org. For BTN TV and the City of Bristol, Tennessee, I'm John Luttrell.